The chanting of solidarity sung by the Joint Health Sector Union Yaba branch. It comprises of Medical and Health Workers Union of Nigeria and National Association of Nurses. This group make up more than 80% of the workforce of this psychiatric facility, and they are determined to continue the struggle until their needs are met. Their grievances include the privatization of this diagnostic center that was built and equipped by an oil company and the non-payment of their promotion arrears.
The money is so much, almost 300 and something million, going to run into 400 million. And we are saying the government should look into this. We've been calling on them, and this is going to 5 years. Are we now going to say we are going to compete with ourselves within the same establishment? We have a government establishment that is purposely meant to take care of the needy and the less privileged by means of subsidized services.
We also met with the management of the Federal Neuropsychiatric Hospital Yaba to hear their side of the story.
In 2013, our hospital was introduced to this IPPIS system of payment, in which case every member of staff now gets his money, his or her money, monthly salary from Abuja through IPIS. Okay? When your money is paid through IPIS, you receive your salary every month. When you are promoted, as is always the practice of government, there is no budget for your promotion in that year. If you are promoted, for example, from level 9 to level 10 to level 11, it is not budgeted for because it was not expected. It is when you are promoted that the competition is done and taken to Abuja, and the budget office is notified. And the budget office tells you that we have no provision for that this year. The payment will be next year.
The medical director also says the reason for wanting to privatize this state-of-the-art laboratory is to sustain quality maintenance.
I told them that this is just for, it's a contract which we can terminate after 1 month. If we are not satisfied after 1 month, we can say, no, we don't, this thing is not okay for us. If it is okay, after 3 years or so, we can say we want to review the terms of the agreement. Why don't you let's try it? They say no. Then I told them that the tail does not wag the dog. It is the dog that wags the tail. It is management that dictates how the place should be run.
The psychiatric hospital was established more than 100 years ago. On the average, it attends to more than 400 outpatients daily and more than 350 patients on admission for a minimum of 2 months. Doctors in the facility are not on strike and skeletal service is being rendered, but without the cooperation of the other sector of the hospital, it will only be a matter of time before the system is crippled if the misunderstanding is not resolved. Vivienne, Irikefe, TVC News.